It is our AGM. So a very warm welcome. Absolutely delighted to be having my second AGM, having only been here 7 months, which is great. And it has certainly been a year of significant change. So together with our staff, we've developed and launched our new purpose, which is that we want our hospitals to deliver care our staff are proud of and our patients are happy with. But most significantly, I think for the last year and recent times is having come out of special measures after having been a decade in very different regulatory regimes. So a very positive place to be. This incredible achievement reflects the commitment and hard work of our 9,000 staff, more than 2/3 of whom live locally, to improve the quality of care and that our patients receive. And more than 400 of our staff are on apprenticeship programmes. And I was really proud to take part in our recent graduation ceremony to celebrate their successes. And it really is excellent to know that we have been rated good in all areas by Ofsted following the first inspection of our apprenticeship and career hub. So I would like to thank everyone in the Trust for their dedication and their compassion in often very difficult circumstances, as we hear so much about. This is never truer than in A&E, where far too many patients are still waiting too long in corridors, and despite making strides in improving our performance, we still have that scenario on corridor beds. And that's why we launched our campaign to raise £35 million to redevelop it, and I know Matthew will share a bit more about that. But I'd like to take this opportunity in that context to thank our local MPs for their public support, and I hope we'll have some good news to share soon in relation to our ambitions for A&E. As the financial pressures continue across the NHS and are becoming increasingly difficult, so this translates into increasingly difficult pressures on our services. We're constantly seeking new ways to deliver care for our residents across our 3 boroughs and across North East London. Harnessing the benefits of partnership is key, not just as an individual, but as a wider system. We continue to work with our neighbours at Barts Health and Homerton Healthcare as an acute provider collaborative to deliver shared services for the benefit of both patient and taxpayer, as well as with other partners across the other players within the NHS and our partners in social care and voluntary sector. We're also operating on several sites across our local boroughs so that residents can access care closer to home. Our 2 new diagnostic centres at Barking Community Hospital and St George's Health and Wellbeing Hub in Hornchurch are providing an extra 94,000 scans a year. We have a women's health hub in a shopping centre in Ilford and an ageing well centre at St George's. This work is being driven by our senior leaders, and our executive team has been further strengthened with our Chief Operating Officer, Fiona Wheeler, taking on the additional role of Deputy Chief Executive. Andrew Dina, who was born at the old Ilford Maternity Hospital, became part of King George Hospital, taking over as our Chief Medical Officer, and Nick Kane taking up the reins as Chief Nursing Officer when Catherine Holford, who was awarded an OBE while at the Trust, left after nearly a decade. In the last 12 months, we've also laid the foundations as we prepare to launch our new electronic patient record in November, a really exciting step forward that will bring us into line with other non-profits. I think it's fair to say that while we have faced many challenges and shall continue to do so, it's been a year of positive change, and I'm delighted to share that our transformation over recent years has culminated in us being shortlisted for the HSJ Trust of the Year award. We'll all be waiting for it in November when the winner is announced. And of course, it's not our only HSJ success. Would be remiss of me also not to mention that Matthew was their CEO of the Year in 2020. On that note, I'll hand over to Matthew to tell you more about our successes and our challenges.
Thank you very much, Chair. So a couple of areas we just wanted to highlight. One is the Chair's already mentioned the effort we put into transforming our accident and emergency departments. Probably the biggest, most visible area of concern in the local population is tending to be the delays that they faced in A&E at Queen's and King George's Hospital. And we've moved over the last few years from being the worst performing sites in the country to being in the top 3 in London and in the top 20% nationally as well. We continue to face ongoing challenges, particularly around the care of patients awaiting mental health inpatient treatment, and also corridor care for the frail elderly. The A&E here was built for 325 people, now regularly sees more than double that every day. We have been working hard to try to secure £35 million worth of funding to do the rebuild work we need, including meetings with the ministerial team at the Department of Health and Social Care. And we're hoping at the end that the NHS's move to multi-year capital settlements will lead to a security in that money. Big benefits for patients and staff to come off the back of that. One of the areas we've made real progress is in frailty. Part of the benefit of the opening of the St George's Community Diagnostic Centre was the move of the Barts Health Renal Centre here, which provides renal care for local residents across our patch, to the new St George's facility. We've turned that into a really first-class frailty same-day emergency care service, which gets fantastic patient feedback and means more of our older residents are able to access good quality care when they need it in much more appropriate surroundings. We're doing a lot of work in waiting lists. We've taken, I think, close to 10,000 patients off our waiting lists compared to the numbers we had around a year ago, including reducing the number of 52-week waiters significantly. And we're the best performing acute hospital in London now for seeing and treating people within the 18-week standard. We've benefited hugely from 2 new theatres here at King George Hospital, and also from the work we can now do at our 2 community diagnostic centres in Barking Community Hospital St George's. And underpinning lots of this is really good performance by our radiology teams, where we've consistently been delivering on the national standard for access to radiology services for months. And a couple of other areas of finance, we've made some real reductions in our spending in key areas, for example, in agency staff and others, but we continue to work within a very tight financial envelope. We've had 2 years of very successful cost of living delivery, which has seen us exit financial special measures. But we continue to face really stretching problems, and this is very familiar with those problems. There's no immediate sign of that easing over the next couple of years as we work within a tight financial envelope. And we'll be interested to see how the 10-year plan helps us with the shift of resource into community and primary care services, which we hope will reduce demand for elective care, along with longer-term goals around improving public health, which we know for many of our residents would make a big difference in the years to come. Finally, just talk about the workforce. One of the best things about our trust is the people that work here. Last year, 55% of those staff responded to the staff survey. It was the highest number of people who've ever responded to the survey here at BHIUT, and it was up 14% on the year before. So we've had really good contributions, and it was great to see in all the key areas that we've made positive, statistically significant improvements in people's experience of working here. And that's reflected in things like our turnover, reducing our vacancy rates, and generally a trend of us becoming a much more attractive employer. The posts that 2 or 3 years ago were extremely hard to fill now to attract really good, strong, high caliber candidates across the board, actually, which is really good to see. And within that, there's been a number of individual programs that I want to call out. One is Project Search, where we're about to enter our next internship on that, which is both providing young people with learning disability difficulties with the experience of work, but also now for 8 people with permanent employment in the NHS. These are really life-changing interventions for young people. It's not just the young people themselves that benefit from it, though. It's the entire clinical, operational, estates, facilities, finance teams that work with them. And when you speak to those of our staff who've mentored and supported these young people into employment, it's clear it's a tremendously rewarding thing. And that benefit to our staff, it's felt by our patients, because actually that general sense of this being an employer that cares about its staff is something that's helping us improve patient experience. And we're seeing that coming through in our friends and family tests. And we're investing in apprenticeships as well, which we think is contributing to our lower turnover and our better ability to recruit. We're part of the 5% club. And we're also a registered provider of apprenticeship trainings, and we were rated good by Ofsted in our first inspection for that. And we're looking forward to developing that offer in the year ahead. And we're also continuing, despite the constrained financial environment, to say thank you to our staff. So through things like our staff family fun day, which we had done into a fun weekend this year, and more than 3,500 staff at it. I had a number of staff at that who it was their first year at the trust, and they said they've never worked anywhere where they've been treated as well as they've been treated here at BHIUT. And those people there who said their kids had said, I want to work here because if this is what they do for you, this must be a great place to work. Hearing that kind of feedback, actually, for something that's a very cost-effective intervention, is really worth it. We've just had our school uniform fairs again to support the school uniform for the kids that are in the new school year. continue to do a range of other things to try to improve people's experience, and also sure that we appreciate it. Finally, looking forward, we're finally moving out of the digital dark ages into probably the digital middle ages. As we roll out our new electronic patient record and a suite of associated things, but that will in time be transformative once we get embedded. It has been a very difficult experience for the organisation getting ready for this, because we are moving from a very dated actual way of dealing with patient records into something much more modern. But in time, the real benefits of this will be actually the clinical experience of working here, but also the patient experience of just everything from appointments, correspondence, etc., being accessible to people digitally. It'll both make us a more productive and effective organisation, but one where both the staff and the patient experience is better. And then looking forward, we're really keen to build on our strong partnerships in place to implement the goals of the 10-year health plan, which were very appropriate for us and lots of initiative from hospital community and from treatment sickness and prevention, three things that really resonate with the needs of the population in our part. So all in all, a good year, more to do, but we progress in the future.
Mike.
Thank you, Sarah. So just a brief summary of the 24-25 financial year. We reported an actual accounting deficit of 31.8 million, but that gets kind of recalculated into a performance deficit, which is 38.9 million, which is what we're held accountable for by regulators. Despite kind of a second year of 3% plus savings, so that's about £30 million, we fell short on our savings target by about 13 million. That was largely to do with or related to the kind of the excessive costs that we have of our growing activity in the emergency care and also mental health patients. We managed to deliver on the 3% national cap for agency staff, which is great and linked to the successful recruitment and reducing vacancy rates that we have. Our elective activity continued to increase, so we're at 30% above 1920 levels, and that really reflected through in our productivity ratings. We're in the NHSE measures, we're in the upper quartiles. We did earn less money through our community diagnostic centres than we thought, just due to a bit of delay in new pathways embedding. But ultimately, you know, they're sound investments that will help the services that we're providing going forward. And then just onto our capital investment, we spent another £38 million investing into our services. Over the past 4 or 5 years, that takes investment into or north of £300 million, which is a sizable increase. Before that, we were running at kind of £5-6 million a year. That has allowed us to finish off the investment in our digital infrastructure pre-EPR. So we've invested £11 million in total over the past couple of years getting ready for the EPR. We've also, like I say, finished the CDCs, and we are continuing to modernise all of our clinical equipment and reducing our backlog maintenance to make the estate worthy for our patients and staff. Then just to the year ahead, so 25-26 is going to be a challenging year. We know money's tight. We're looking for a £61 million saving this year in order to hit plan. We need to continue focusing on our temporary staffing costs. We need to continue to work on productivity and real focus on corporate costs to make sure we can focus as much money on frontline services as possible. So a tight, difficult year ahead for money.
Thank you. Excellent. Well, a real whistle-stop summary of the year, but I think it's given us a sense. It's time to throw open to any questions. Any questions? No. Good. Lovely. In which case, I think we can say thank you very much, and we can bring our AGM to a close. Sorry, you've got questions. I'm so sorry. Go ahead, Martha. I didn't notice you've gone really small because of the presentation. I couldn't see the hands. Martha and then Mark.
Thanks. I hesitate to ask this question because clearly it's going to delay colleagues being able to go home. But I think from a public perception point of view, because no doubt this information is going to be within the public domain shortly after the AGM. It's clear from the financial report that we've had, as an organisation, we have made significant savings in terms of staff costs in particular, but in other areas as well. I mean, for example, in our procurement area and things like that, we've become much more effective. I think the question I would put, particularly from the perspective of the population that we serve, is what do we think the impact of these savings will be on our service delivery going forward? Because I think that's the thing that's going to be uppermost in people's minds when they see our annual report and they see the summary that we've just been given from a financial perspective. Thanks.
So I think the savings need to be seen in the context that we've got the highest number of clinical staff that we've ever had as an organisation. So what we're not trying to do is to reduce the number of people working clinical shifts. What we're trying to do is to reduce the overheads associated with the greater use of bank staff that we can afford to do. So if you look, for example, we've got, I think, around 100 more consultants than we had. I think it's 89 more consultants than we had 3 years ago, around 400 more nurses, and around 100 more therapists and so on. In fact, it's 80. I know that number well because we discussed it a lot last year. But so what we're doing, Marta, is not reducing the number of clinical staff on the floor. We're just trying to reduce the spend on temporary staff and shifts. But every clinical service in the organisation has got the highest number of deployed and substantive clinical staff than it's ever had. The key issue that is, in addition to that increase in substantive staffing, we've also maintained a slightly higher than affordable spend on temporary staff. Any savings programmes we do go through a quality impact assessment to make sure that we are content that we've mitigated any clinical risk.
Thank you. Are you coming in on that, or is it a second question? Okay.
Yeah. I mean, as Martin raised a really good point, it will be in the minds of our organization. You take an example of ESCA, where elderly frail patients were waiting in ED for hours and hours on end to be seen. We've actually made savings by having them seen elsewhere, quicker, faster, and in a much more friendly environment, an environment that meets their needs far better. That has resulted in improved outcomes and a sustainable service. Our savings programme has always been predicated on sustainability of those savings against delivery of models that improve patient outcomes, and I think that's the focus that we've always had and will continue.
Thank you. Really helpful comment. Mark.
I just wondered, Sarah, whether we should take this opportunity to congratulate the executive team and through Matthew, perhaps all the staff. This organisation now projects a different level of confidence, not just in itself, but you can see improvements in different ways in what is probably one of the most challenging times in the recent history of the NHS. And, with regard to the finances, I think the difficulty here is, as we heard earlier, so many moving parts that are beyond our control. There's a certain ceiling that you hit where, because other organisations are codependencies, you cannot necessarily progress in those areas so easily as you would do if you were entirely masters or mistresses of your own destiny. So I just think in the context of all of that, the churn, finances are very difficult. I think if you set people an impossible task, you find that they find it really hard to deliver on it. So I think people should feel, the senior team should feel our warmth today on a great annual report and the way in which this organisation is progressing. Thank you.
Thank you, Mark. Yeah, I completely agree and endorse that. It's been a really strong performance and we're in a very good place. And having been obviously once a very challenged trust, it looks and feels very different now to how I'm sure it did a few years ago. And absolutely, that the example shines through when you talk to people who are talking about how long they've been here and how proud they are to work here. the numbers speak for themselves from a workforce point of view. And I think it's an absolute testament to the strong leadership. Brilliant. Okay, if there are no further questions, having tried to prematurely, I will now formally close the AGM. Thank you very much indeed. See you all soon.
Thanks. See you soon.